strategies have you found for coping with anxiety that are the most successful with your clients?
Well, I guess what we could say before I start is that our mind is a bit like an untrained puppy sometimes, isn't it? And it's about kind of reining it in a little bit.
Definitely.
Yeah. So with anxiety, it's how we start to learn to manage and contain it ourselves. And what I might do to begin with is encourage the client or the patient to start to link thoughts, feelings and behaviour.
Right.
And to do that, in between sessions, I might ask them to start to notice what their thoughts are. You know, whether when they're not anxious, when they are anxious, what are they thinking? I might ask them to choose a worry scale, whatever that would look like. What does their anxiety look like? Someone might describe it as a thick fog in the room one day, and actually they might come another week and say, well, it's over in that corner. So it's, you know, it's being contained. So what's containing it? Right. What are your thoughts? You know, so starting to get them to notice. I also will remind them that thoughts and feelings are not facts. So again, it's how they can start to challenge some of those thoughts with no substance before we go down a rabbit hole. And that's what I call them, you know, have you gone down a rabbit hole? And so it's looking sometimes with cognitive behavioural tools, and that's what these are. I also will encourage them to get a bit of information gathering. So I might ask them to try to recall any information that the medical professionals have told them, if they have, and write it down. Right. You know, don't lose the real stuff. If they've had that given to them, if they've had some, I don't know, good information given to them that's made them feel a bit reassured, write it down, because fear will fuel the anxiety, and that's the ammunition that they can use to challenge some of those thoughts with no substance.
Sure.
Also, introducing structure back into the week is a really important thing too, because the world shrinks, doesn't it? You know, often patients will say, well, once I had the diagnosis, the world became the hospital. I gave up work for a while, you know, so the world starts to shrink, and there's a lot of time to sit and think.
Right.
So what I might ask them to do is start to look at what they used to like doing. They probably won't feel motivated, and I think it's often unrealistic for me to think that most patients that come through my door are going to feel motivated. Okay. So what I might ask them to do is do something before they feel like it, and tolerate that feeling that's there when they do it, because they won't want to do it.
Right.
Whether it's something they used to like doing, for example, I had somebody that used to like going swimming. It wasn't just the swimming she liked, but she said, you know, when she went, she remembered the smell of the chlorine, that warmth, just the whole experience of going, which made her want to do it again. Right. So it's getting back in touch with what she liked about it.
So you mentioned cognitive behavioural therapy, CBT.
Yes.
Tell me a little bit more about that.
Well, that helps to actually change your behaviour and the way your thoughts affect how you feel and behave. So in a way, as we've just said, your mind is kind of like an untrained puppy sometimes, and when we're frightened, fear fuels our thoughts.
Sure.
So actually cognitive behaviour is like tools there to help manage thoughts and contain the anxiety. So it can be very helpful for people to feel that they're starting to take control of how they feel and behave. So again, with all of these things, these are all tools. Even with the worry scale, it's all about helping people. I like to kind of help people to externalise their anxiety so they can see it. They can see that they've got some control over it. Right. So cognitive behavioural therapy is very much something that will give them tools to help them to change their behaviour, change their mindset, their way of thinking about something. It might be, how can you see this differently? So perhaps if somebody is having perhaps thought traps, we call them thought traps, thought distortions sometimes, and one of them is catastrophizing, and that might be an example of somebody saying, although they say my prognosis is good, I know the cancer will come back. Right. Well, it's highlighting those thought traps really, and challenging them. Okay, I know that's a worry thought. What evidence is there? What evidence is there to say that will happen at the moment? Is this my opinion, or is it a fact? So it's questioning that in the head and getting people to perhaps learn to not accept the first thought that comes into your mind. And that takes time to do. It can feel a little bit strange at first, and it needs practice, but it's just helping people to start to take control of their thoughts, feelings and behaviour. So
those kind of treatments, like CBT, is there any possibility to access those via the NHS?
They're in some areas, and it very much depends on the area.
So who would you recommend speaking to, perhaps?
I would recommend the patient to perhaps talk to their cancer nurse specialist, and perhaps their GP, just to see what's in the area, to see what support they can access. As I said, it will very much depend on the area.